Hey everybody, my name is Dr. Lindy Thalberg, and today we're going to be covering the fourth part of our Thrive on 5, which is exercise. Unfortunately, I got to use some cheat sheets because there's too much information here. Now, what we're going to be covering here is that physical inactivity is a modifiable risk for cardiovascular diseases and a variety of other chronic diseases such as diabetes mellitus, cancer, as in colon and breast, obesity, hypertension, bone and joint diseases, as in osteoporosis or osteoarthritis, and depression. So if you suffer from any of those, you know somebody that does, listen on. Is going to show you how the exercise benefits those things. Now, when you're looking at all causes of death or cardiovascular related deaths, being fit or active was associated with a greater than 50% reduction in risk. Now, it's said that you should have about 1,000 calories of expenditure per week, which is going to be you just sitting there quietly doing nothing. But you should actually do 9 times that amount if you want to get some sort of benefits from it that are really going to help to get your body working better. So things that you need to do is moderately intensive exercises for about 40 minutes. Things that are going to help you out is going to be pushing a lawnmower, heavy carpentry, wood cutting, aerobics as in medium intensity, alpine skiing, competitive badminton, ballet, jogging at 4 miles an hour, biking at 9 miles an hour, football, gymnastics, golf, carrying your clubs, hiking or rope jumping, skipping at about 50 times a minute. Or increase that intensity to 20 minutes a week of weight training, basketball, ice hockey, tennis, or volleyball. All these show great effects into your body. Now, if you suffer from diabetes mellitus, each increase of 500 calories in energy expenditure per week decreases incidences of type 2 diabetes by 6%. So if I had 1,000 calories, I'd decrease that incidence by up to 12%. I have 1,500 calories, I'd decrease that incidence by 18%. Now, if I look at cancers, physically active men and women exhibited a 30 to 40% reduction in the relative risk of colon cancers. Physically active women reduce their reduction of breast cancers by 20 to 30%. The greatest benefits for reducing incidence of breast cancers were if you worked out 7 hours or more per week of moderate to vigorous intensity exercises. Now, if you had established cancer, walking 1 hour or more a week was associated with improved survivability of it, and that's compared to people that didn't work out. And the greatest benefits were among cancer survivors were seen when they did 3 to 5 hours of workout at an average pace. You look at someone with osteoporosis. Weight-bearing exercises, especially resistance exercises, appear to have the greatest effects on bone density, and athletes who engage in high-impact sports tend to have increased mineral deposits than people that didn't engage in the high-intensity sports. A 6-month trial was done, and people put into groups of 3 kinds: resistance training, agility training, and stretching training to see which one actually increased densities. They said resistance training increased that density by about 1.4%. Agility training did increase that density by 0.5%. And stretching actually had losses in cortical density. So if you stretch, not good for increasing bone densities, okay, especially if you're osteoporotic. Now, physical activities requiring impact or significant loading on the joints are advocated for optimal bone health. So running distances of up to 15 to 20 miles per week has been associated with increasing or maintenance of bone densities, but longer distances than 20 miles may be associated with reducing bone density. So keep that in mind. When you look at somebody with musculoskeletal fitness issues, so people that are going to be looking at is going to be more geriatrics because they're in jeopardy of actually losing their functional independence. So if you get older, we get tighter, you don't work out as much. These people, when you get up, maybe you can't get up from a couch, maybe you can't go up your stairs anymore, and those people start to lose their functional independence, so they have to start using devices or rely on other people. And so research has said that enhancing musculoskeletal fitness is positively associated with functional independence, mobility, glucose homeostasis, bone health, psychological well-being, and overall quality of health. And that this goes in direct support for the recent recommendations that resistance training and flexibility exercises being performed at least twice a week should be done to maintain functional status, promote lifelong physical activity, and enhance your overall quality of life. When you look at brain aspects here, mood enhancements, usually within 5 minutes of moderate exercise, you get a brain enhancing effect. And when you look at people that are more physically active, these people are usually less depressed. And these research projects have said that exercises has been concluded that when generally compared to antidepressants, they're as effective as antidepressants for patients with major depressive disorders. So exercise not only seems to be important in treating depression, but also seems to be really good in preventing relapses of that depression. Now, people with diabetes are more likely to develop depression, and people with depression are more likely to develop diabetes, more so than the general population. So then a number of studies have shown that people that have both these disease processes have better chances of morbidity and dying than people that have only one of those alone. And now when people that had diabetes went and exercised for 12 weeks in that research project, they found that not only did they improve their depression, but they actually reduced their blood sugars, which is fantastic. And when you're looking at dealing with, say, fight or flight reactions and anxiety, when you get spooked or threatened, your body goes into alarm mode, and you actually start getting symptoms of sweating, dizziness, or increased heart rate. Now, some people are sensitive to those sort of things, and then they manifest those things as fear. And so later on down the road, these people are going to be more susceptible to getting panic disorders. So the research has said that exercise in many ways is like exposure treatment. So the more you get people to actually work out, it associates these symptoms with safety instead of danger. So the more that you work out, the better you get at handling anxiety. When you look at inflammation, this is big because inflammation has had an underlying link towards a wide range of diseases and disorders in the brain and in the body. And exercise has been shown to reduce a number of inflammatory markers which are linked to these diseases. 20 minutes of exercising a week has measurable effects on the immune system, but in order to maximize those benefits, repeated and regular exercises is most recommended. Now, also when you're looking at dealing with things, slowing the aging process. As we age, our chromosomes shrink, and that's classified as what's called telomeres. And as we look at people when we age, people who have lived a long life have telomeres that are in better shapes than those that don't. And people who regularly exercise, it's been shown that their telomeres are about 40 base pairs longer than people that didn't work out. And this comes out to roughly being about 9 years less cell aging than people that didn't work out. And what helps to maximize that sort of effect is going to be interval training. So if you do interval training, that's going to help to boost you up better than weightlifting or moderate exercises. Now, when you look at brain increasing, so the increase of brain neurons is called neurogenesis. And the activity of the process of getting in there to build that brain up is called neuroplasticity. You want to get that brain more active and get that brain function, get it more stronger. What seems to spur the growth on of new neurons is, above other activities, is actually aerobic activities. So you do more aerobics, you're going to get, or aerobic activities, you're going to get more benefits of neuroplasticity and brain growth. Other things like meditation and antidepressant medication have also been shown to trigger on new brain growth. So the big question that we have is, how much is too much? Well, nobody really knows exactly. Now, the things that people will agree on is that more physically active people are at the lowest risk for problems. However, the greatest improvements in health seem to be those ones that are the least physically active when they become more physically fit. And researchers have pointed out that if people exercise more, this could reduce a huge number of deaths worldwide. Basically, what they're saying is that when you calculate all the deaths that occurred through cancer, if we would have exercised more, we could have reduced over half of those ones. So then now the big things that people do agree on is that most health and fitness organizations and professionals will agree that you should have about 1,000 calories expenditure per week, which is roughly you just sitting there breathing quietly. If you do about 150 minutes of moderate activity, it's going to help to boost the body up and get it functioning better. So those exercises we talked about earlier, something like that is going to get your body working better. Okay, so the more you exercise, you're going to get the body stronger in a lot of different areas and help boost up that immune system also in the process. So again, exercise, get working better. If you like the information you heard, give us a little thumbs up. Got some family friends that don't work out, don't know why they need to work out, send this out to them, get them to actually boost that immune system also. Otherwise, come back next time. You're going to cover our last one, our Thrive in 5, number 5, which is going to be mindset. So you try to have yourself a good night, and we'll check you tomorrow. See you then.